Today, we're diving into something pretty intense. It's a severe medical emergency where the body's own mechanics, the very act of breathing, actually turn against itself. We're talking about a traumatic injury that literally breaks the chest, and understanding it really gives you a new perspective on just how fragile our bodies can be.
So let me ask you this. What would happen if a piece of your rib cage just broke free and started moving on its own? It sounds like something out of a sci-fi movie, right? But for paramedics and ER docs, this is a very real and very critical emergency.
All right, so let's get right into it. What exactly is this critical injury we call flail chest?
Okay, so here's the deal. Flail chest happens when you have multiple ribs right next to each other. We're talking at least 2 or 3, and they're fractured in multiple places. And that right there is the key. It's not just one crack per rib. Each of those ribs has to be broken in at least 2 different spots. When that happens, you get this free-floating segment of the chest wall.
And this is where the real problem starts. That broken section is now totally disconnected from the rest of the rib cage. A great way to think about it is like a section of a picket fence. Imagine someone came and sawed through the top and bottom support rails. That little group of pickets can now just wobble back and forth, completely independent from the rest of the fence. Well, that's exactly what's happening inside someone's chest.
Now, this whole free-floating segment leads to the most bizarre and counterintuitive part of this injury. It's something called the paradox of breathing.
And here is where the body starts to fight itself. Okay, think about how you breathe. When you take a breath in, your whole chest wall expands outward, right? But with flail chest, that negative pressure you create inside your chest actually sucks that broken, free-floating piece inward. It's moving in the exact opposite direction of everything else.
And the paradox just keeps going when you breathe out. Normally, your chest wall moves back in when you exhale. But that flail segment, it's no longer anchored down. So the increasing pressure inside your chest pushes it out. So it moves in when it should be moving out, and it moves out when it should be moving in. This totally chaotic, paradoxical motion is the absolute hallmark of this injury.
So we get the weird mechanics of it, but why is this so unbelievably dangerous? Well, the problem goes way, way deeper than just a few broken bones.
You see, all that bizarre opposing movement, it just wrecks ventilation. And ventilation is simply the body's ability to move air in and out of the lungs. With that segment moving incorrectly, the lungs just can't expand and contract the way they're supposed to. The fundamental mechanics of breathing are completely broken. And when you can't breathe properly, what happens? That leads directly to a very dangerous state called hypoxia. All that means is the body isn't getting enough oxygen. If you can't ventilate, you can't get oxygen into your blood, and that, my friends, becomes a life-threatening emergency fast.
But believe it or not, the danger doesn't even stop there. An injury this severe is like a giant red flag for a bunch of other problems. The kind of high-energy trauma you need to cause a flail chest, think car crashes, often means there's also a pulmonary contusion. That's basically a deep, serious bruise on the lung itself. You combine that lung injury with the severe pain that stops someone from taking a deep breath, and you've got a patient at an incredibly high risk of complete respiratory failure.
Okay, so knowing how bad this is, how do first responders and medics even begin to manage this kind of crisis out in the field? Their response has to be fast, it has to be calm, and it has to be deliberate. For medics on the scene, the priorities are crystal clear. First things first, support ventilation. You have to help the patient breathe. Second, you have to control that intense pain, because doing that can actually help them breathe better. Third, you stabilize that floating segment, often just with a bulky dressing, to try and reduce some of that paradoxical motion. And finally, number 4 is rapid transport. Getting them to a major trauma center is absolutely critical.
So, we've gone through a lot of detail. If you're going to walk away from this explainer with just one core concept locked in your brain, what should it be?
It all boils down to this, right here. Flail chest equals multiple ribs fractured in multiple places, which leads to paradoxical chest movement, which results in respiratory compromise. That one sentence connects everything: the injury, the sign, and the life-threatening consequence. It's the whole story.
You know, when you really think about it, flail chest is more than just a medical term. It's just a stark, incredible reminder of how fragile our body's design can be. But at the same time, it highlights its powerful, desperate will to do the one thing it needs to do most: just breathe.